Welcome back, everyone. You're still watching Politics Tonight, digging beyond the headlines. And now to our interview with the guest of the day. I am joined by the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, for discussion on the form and contents of President Tinubu's health reform. Prof, good evening to you, sir. Thank you so much for joining us on Politics Tonight. It's a pleasure.
Thank you. Thank you for having me.
Right. So today is International Women's Day. As Nigeria's Minister for Health, what are your efforts in boosting women's health at the primary and secondary levels?
I will start by echoing Mr. President's message as well as the felicitations of the federal government of Nigeria to all Nigerian women on this International Women's Day, and particularly in the health sector, where in the formal sector, 70% of the workforce in health comprises of women, whether as nurses, midwives, medical doctors, pharmacists, laboratory scientists, and other care providers, and informally in our homes, in society, as spouses, as mothers, as sisters, as partners, and as contributors and leaders. So it's a day to celebrate all women. So in the context of that, the thrust of President Bola Ahmed Tinubu's Renewed Hope agenda puts the health and well-being of the population at the very center of it. Yes, it's important to have growth, but also it's important to focus on the people. And within that, women are a significant part of it, either as the providers of care or in terms of the beneficiaries of the care that is being provided. So focusing on maternal, newborn, and child health, for instance, is focusing on women, on mothers, on adolescent girls, on women throughout their reproductive life stages, and to ensure they are protected, they have the necessary services to have healthy, productive lives and contribute meaningfully to society. And that is what we have been working on as part of the health sector renewal agenda, expanding primary health care, expanding the training of frontline health workers, and I can talk more about that, and enabling the health personnel that we have to deliver services to our women, whether they're in rural areas, whether they're in urban areas, and to expand the training that is available as well for the health workforce of the future that we need, tapping in this direction, the youthful potential that this country is very much endowed with. So there are many facets of what we're doing in health that is primarily focused on women. In addition, when you look at things like cervical cancer, one of the things that the President, under his direction, we launched was the HPV vaccine, the human papillomavirus vaccine, to prevent cervical cancer among women in the future. More than 5 million young girls had been immunized against this virus, which can cause cervical cancer, protected them effectively from a disease that afflicts women. And there are thousands of women who suffer from it from our country. Those are all the efforts that we're making to ensure that we safeguard the basis of our healthy population, which is our girls, our adolescent girls, our young mothers, our older mothers, our aged mothers, all over the country.
Right. So, I mean, as a woman, this is very important to me. So let's stay on this for a minute. Let's speak of primary health care delivery. What are your strategies to reduce maternal and infant mortality, especially in the rural communities in Nigeria?
You will recall that His Excellency Mr. President unveiled the Health Sector Renewal Investment Initiative on December 12, 2023. And at that time, we saw the federal government signing a compact with all the state governments in this country for the first time to move towards expanding primary health care all across this country, and joined by our excellent development partners, grant financiers, who had complemented what the federal government was trying to do by committing over the next 3 years additional investment. They announced $3 billion at that event. Now, since then, we've been working out how to expand, how to make sure that the 8,800 primary health care centers that are receiving direct facility financing through the Basic Healthcare Provision Fund are ready to receive those funds on the supply side, so that health workers have the resources they need. that they are enabled in terms of their stipend that they require to deliver services in the front end, that the commodities are there as well. And on the demand side, to ensure that the Vulnerable Groups Fund is expanded so that the vulnerable population are able to access care without facing catastrophic expenditures. So having financial protection by expanding the Vulnerable Groups Fund. In the last few months, more than 700,000 Nigerians have been enrolled in this effort through the National Health Insurance Authority, and more will come. It's not enough. Nigerians, I think we're not at that point where we'll say we're comfortable. Less than 16 million Nigerians are currently health insured. That is a very small number, considering that we have spent almost 20, 30 years on this journey to expand healthcare insurance. But we are moving forward in a deliberate manner so that on the demand side, we ensure that care is affordable. And the National Health Insurance Authority is expanding that, and we've started in that direction so that care is affordable. People are not suffering from diseases that could be treated at the primary healthcare level. While on the supply side, the direct facility financing is going to be channeled so that health workers in the front end, that the federal government is providing resources and the states will be complementing those resources so that Nigerians have access and are guaranteed basic healthcare services to reduce maternal health, maternal morbidity, child morbidity and mortality. Immunization, most cost-effective public health intervention. Federal government is providing those resources, working with partners to ensure that the supply chain is functioning and that our children are protected from diseases that can cause losses of life.
So, Prof, we'll definitely come back to Nigeria's insurance structure, but still on primary health, which is an essential tier in healthcare, especially in rural centers. What is the spread and strength of primary healthcare in Nigeria?
Sorry, I lost you. Can you repeat that question again? Yes.
Right. So earlier I said we were going to come back to Nigeria's insurance structure. But let's stay on primary health, which is an essential tier in healthcare, especially in rural areas. So I'm asking, what is the spread and strength of primary healthcare in Nigeria?
I think there are at least 24,000 primary healthcare centers spread in the 36 states of this country. Two-thirds of them are publicly owned. They are under the purview of local governments and state governments. And many of them are not fully functional. Many of them are unstaffed, are not well equipped. That is a situation we've inherited. And while there are frontline health workers that have been trained, whether they are nurses, whether community health workers, nurses and midwives, and other health providers, some of them have tools that have not been updated for many years. So the fact that they exist and they are recruited by states and local government is good. The fact that some of that basic infrastructure is available is good. But I think the weakness is that the functionality can be improved. And that is why, as part of the Health Sector Renewal Investment Initiative, we are focusing on revitalizing the physical infrastructure, the equipment, and retrain the frontline health workers. Because at the end of the day, women, children, elderly, and our rural population will go to facilities to receive care, whether there's roof over the facility, basic equipment is available, and the commodities are available, and the health workers are themselves trained. That is why we're embarking on retraining these 120,000 frontline health workers. And in the last few months, we've updated the training guidelines. The training will commence in March. We've mobilized the resources to be able to execute through the National Primary Healthcare Development Agency, so that Nigerians, when they go to some of these facilities, they will begin to access quality care for the 8,800 facilities and then expand them over the next 3 years to get to at least 17,000. It is not something that the federal government can do alone. Hence, the compact with the state government is so important that the efforts of the federal government under the leadership of the president ought to be complemented by state governors. And I believe that the leadership we have seen of the Nigeria Governors Forum and repeated interactions through the Economic Council tells us that the state governors are also committed in this direction to expand the resources that they put on the table to complement what federal government is able to do on the supply side, as well as on the demand side, of course.
Right, so what's the commitment level of state governors on this?
The fact that they have signed a compact for the first time, I think it's telling by itself. For the first time, we have an agreement between the federal government and the 36 state governments, as well as our development partners in a certain direction. So that direction has been set. That had not been done before. Secondly, the fact that we have resources under the Basic Healthcare Provision Fund and have attracted grant financing to complement that, I think offers incentive for the state to see that if they move with us in the direction that we are going to expand investments in the front end so that Nigerians get the services that they need, that they would also see the dividends, because at the end of the day, primary healthcare is something that requires all levels of government and all levels of society to engage in it. Because health is one thing that requires all of us working together so that Nigerians get the services that they need and the protections, in fact, that they need to prevent disease outbreaks that can undermine our economy as well as our progress in human capital development in the country.
Right. Let's talk about cerebral malaria, which is a very severe health issue. What's our malaria plan? Is it still the world's most dangerous killer disease?
If I heard you correctly, your question is on malaria. I think malaria is one of those issues that I believe is very important for us to address as part of this effort in renewing the Nigerian health sector. For more than 70 years, we've had a malaria program in Nigeria, but yet we have 30% of the global burden. So doing more of the same is not going to be, is not going to get us to the result that we need. And in fact, this week in Cameroon, my colleague, the Minister of State for Health, attended the ministerial forum to look at rethinking malaria on the African continent, including the potential of things like vaccines. But even before we go to higher and more sophisticated tools, there are some basic tools that we need to expand. Seasonal chemoprophylaxis, some of our bilateral partners have been supporting that. Bed nets, which are preventing mosquitoes from transmitting the parasite that causes malaria, expanding that. Until recently, I think most of those bed nets were provided through bilateral partners. But we need to look at all those interventions and optimize them and deliver them in a way that will break through so that we change the direction of this country. In addition to the case management, which requires functional primary healthcare centers, which have the health workers to be able to test, but also the commodities to be able to treat those who are infected. At the end of the day, there are other elements of malaria control that are on society to ensure that the environment is one that doesn't allow mosquitoes to breed. And in fact, today I had the privilege of receiving Her Regal Majesty, the wife of the Oni of Ife, who is the malaria ambassador for Southwest Nigeria. And we discussed how to activate traditional leaders, community leaders all over this country so that communities are also involved. It's not only one level of government that will stop malaria. It's all of us working together to break through and to do things differently in getting the simple interventions that other countries had been able to do, but we have not been able to do, and that is why we have 30% of the global burden of malaria that is in Nigeria, unfortunately, after many years. In addition, there are elements of the malaria control that requires a value chain that is functional. Take, for instance, the bed nets. Bed nets are not new, but the treated bed nets that are being used to control malaria for a very long time, more than 600 million have been distributed in Nigeria over the last 20 years, but not, I believe, not 1 million or even less than that has been produced here in Nigeria. So how do we begin to expand the healthcare value chain so that some of those commodities that are necessary to address malaria are produced here? And that is why the President announced the initiative to unlock the healthcare value chain so that not only the preventative interventions like bed nets, but also some of the therapeutics, so the anti-malarials, the rapid diagnostic kits that can be produced here. And along those lines, we've already begun to attract folks who are going to come to Nigeria to invest establish their manufacturing plant. There are some, like in Lagos, Colexa has its diagnostic test kits production plant, and we flagged it in December 2023 in line with this unlocking the value chain. And then there are others, a French company that is coming to Nigeria to also establish a manufacturing plant for test kits. And there are others also coming in for other types of test kits so that we have some of the value chain here in our country. So all in all, I believe that if we focus on improving health outcomes, malaria will be among the top priorities. And there are various tools that are available for us. And we're in the process of rethinking our strategy so that we execute differently and hope that the story of the last several decades does not continue in this area of renewed hope as envisioned by Mr. President.
All right. Prof, let's now talk about the federal government's health sector renewal investment initiatives. What are your plans and strategies in achieving this?
Well, I think you know that health is wealth, and health
Absolutely.
is the basis for accumulation of human capital for any population. A healthy population is a productive one. Our goal as part of the Renewed Hope agenda is to save lives, reduce physical and financial pain, produce health, and do so for all Nigerians, not leave anyone behind. And there are 4 pillars to it. One is the governance pillar, where we have brought federal government, states, private sector, civil society, traditional leaders, religious leaders, and reorienting them to respond to the needs of Nigerian citizens. We had a People's Voices survey to ask Nigerians what are their expectations, and we are working hard to see that we reorient our effort to respond to the needs of the citizens, not only for a few, and to strengthen the regulatory framework so that our entities like NAFDAC, the Pharmaceutical Council, the Medical and Dental Council are able to provide effective regulation, not predatory regulation, but effective regulation of the sector, and to be more transparent and more accountable to deal with issues of wastage and where we find issues of corruption, to be able to deal with it decisively. And I can give you several examples of that. The second pillar is to be laser focused on doing the things that will improve Nigerians' health outcomes. So I mentioned the primary health care, the compact that we have signed, the expansion of primary health care through the BHCPF, the immunization effort, the treatment of ailments like malaria, tuberculosis, which Nigeria is doing well. It's one thing that the world has recognized. Nigeria is actually doing well. I'm very grateful that Her Excellency, the First Lady of the Federal Republic, is the global ambassador, is going to be announced soon as the global ambassador for tuberculosis, because Nigeria is doing well in that direction. And not to forget our hospitals, the federal tertiary hospitals. The President recently approved, and we're in the process of executing that approval to expand availability, access to cancer treatment equipment, diagnostics, and we're doing that with the NSIA, the Sovereign Investment Authority, to ensure that Nigeria have the health infrastructure that will keep our health workers in-house and be able to function the way they should, while at the same time expanding the health insurance so that the affordability on the demand side is also enhanced over time. It's a tall order, but we are on that path as part of this health sector renewal and dealing with the health workforce challenges that we have. And there are several things that we've already done in that. Doubling the training of health workers, the quota of training of health workers, and retraining that I had mentioned, 120,000 of them, recruitment of doctors, nurses, midwives. More than 2,500 have been recruited and deployed to the primary healthcare system, who are health workers, nurses, midwives, as well as medical doctors in this effort. So in addition to laboratory scientists and other important cadres of the health profession. The third pillar is to unlock the healthcare value chain. And in doing so, we want to retain the economic value in investing in health, as well as create jobs for our teeming youth. Whether it's on the diagnostics, I mentioned the companies that are coming to Nigeria, whether it's on generic pharmaceuticals production, where we have a Brazilian company that is agreed, has already approved, and will be coming to set up over the next 2 years a plant to manufacture generic pharmaceuticals, whether it's on vaccines, which we're discussing for the Nigeria Institute for Pharmaceutical Research and Development to have an mRNA vaccine hub, whether it's Lassa vaccine that we are envisioning Nigeria will be able to contribute, and we have a task force led by the CDC of Nigeria to begin preparatory steps in the event that an effective and safe Lassa fever vaccine is developed. That is all as part of the value chain. In addition to the private sector, you saw the AfrExim partnership that we have signed. We have signed an MOU for at least $1 billion with AfrExim, not to government, not a loan to government, but a facility that if investors are willing, can go through the AfrExim processes and be able to invest in unlocking value chains so that Nigeria produces some of the commodities that it needs, whether it's drugs, vaccines, devices, as well as health facilities. And we see the Center of Excellence that is being developed here in Abuja. And there are many other interesting things that the private sector, as the President said, Nigeria is open for business, and the health sector is also open for business, but without compromising the public mission. So the private sector is very much a part of what we are trying to do, but protecting the public mission to ensure the poorest and most vulnerable also have access to quality and safe healthcare services and commodities while we are advancing the unlocking the healthcare value chain. And finally, the health security agenda, which is to deal with outbreaks, to sense those outbreaks, to respond to them quickly, to do so using a One Health approach. We inaugurated the One Health Steering Committee, which comprises the Ministry of Health, the Ministry of Agriculture and Food Security, the Ministry of Environment, Water Resources, so that collectively we look at how diseases that are in the animal world can be prevented from getting into the human health arena, or antimicrobial resistance, surveillance systems, as well as strengthening our laboratory capacity and ability to respond when outbreaks occur. For instance, meningitis. 2 weeks ago, we started seeing cases in Yobe State. Yesterday, we received 1 million doses of a pentavalent meningitis vaccine from the Gavi Vaccine Alliance to help us stop this outbreak before it spreads. Whether it's Lassa fever, in many states where we've seen cases, recently in Kaduna, we're able to mobilize with ribavirin, the antiviral drug, and the personal protective equipment to enable health workers protect themselves and improve awareness through the media so that Nigerians know how this virus can get transmitted and we stop it. And many other elements that we are putting in place to address public health threats, in addition to the preparedness for what may come in the future that we don't yet know. Now, all of those have cross-cutting enablers using data and digital transformation. And in collaboration with the Ministry of Digital Economy and Communication, the Minister Bosun Tijani, an excellent professional, we have started discussing how the Ministry of Health and his ministry, we can look at the digital transformation of the health sector. And a task force is already in place. I think will be inaugurated next week by ourselves and led by the Honourable Minister of State, Dr. Tunji Alaosa, to help move us in that direction of digital transformation for health, or the sector-wide approach to defragment the healthcare financing landscape. In the past, development partners, very well intended, but oftentimes very fragmented in how they bring their resources to bear in our country. But with the compact and the sector-wide approach, which the President approved, we have a coherent narrative, one North Star, that all our efforts in health should go towards improving health outcomes, and that our development partners have aligned behind that, aligned behind government priority at the federal government and the state level, and that we agree to joint mechanisms to monitor, and that they will use national systems increasingly, even where some of them might also use extra national systems like civil society and other aid management contractors to deliver services. That is an effort to coordinate better the development assistance that comes to health.
All right, Prof. Let's go on a break, and when we come back, we will talk more on the President's massive investment in health coverage. Please stay with Politics Tonight. We'll be right back.
Imagine a world
where this day is just another day,
where celebrations of progress aren't confined into a single date.
No need to demonstrate our strength or skill.
for equality will be the air we breathe and the ground we tread.
Gone will be the need to recount victories, as every triumph becomes a stepping stone and not a wonder.
No more rallying cries for change, for justice will be the anthem of our daily lives.
This day will fade into the core of our existence, for every moment will be a testament to our unity and resilience. Happy International Women's Day from TVC Communications.
Welcome back to Politics Tonight, everyone. Thank you so much for staying with us. Tonight, we're focused on the form and content of President Tinubu's health reform. And I've been speaking with the coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate. Prof, thank you so much for staying with us. Earlier, before we went on break, you talked about programs to unlock the healthcare value chain. And I mean, sadly, Nigeria has become a country with huge or net consumer of health products manufactured from outside of these countries. Are these programs intended to address this?
Yes, these programs are intended to really change the direction that Nigerian health sector goes. And not only have implications for Nigeria, but for the sub-region, for ECOWAS, because 60% of the market in health can be addressed from Nigeria, and also the Africa region itself. So Nigeria is a net contributor. That is the vision, and that's what we are following through. And there are constraints that are on the policy side in the past, some on the regulatory side, and some on the financing side, and some even with the private sector actors themselves. Until now, Nigeria had not really focused on developing this value chain. But with the President's vision, I think this effort is now front and center of this health sector renewal investment initiative, where we are enabling the private sector to come in, invest, manufacture across different value streams, whether it's diagnostic, pharmaceuticals, vaccines, devices, hospital services, or digital technology, to contribute to our economic growth. Health can be a much bigger part of our GDP than it is. Right now, less than 4%. In many countries, it's 8–9%. So the contribution of health in the as an economic sector is there. It's not just on the consumption sector. The policy direction is clear, and there are fiscal policy steps that would need to be taken to reduce the barriers for the industry to bring in raw materials or manufacturing equipment. The fact that we have been dependent on imports, and with the monetary situation that we have, has contributed to the high cost of pharmaceuticals and the difficulties that many of those who are trading in this country have been facing over time. But over time, with the unlocking and domestic manufacturing or medical industrialization, we should see that improving. And we're doing this in collaboration with other parts of government, not only the Ministry of Health, because obviously the Ministry of Health is not the only actor. There are many. The Ministry of Investment, Trade and Industry, for instance, is key actor. Standard organizations, NAFDAC, the Pharmaceutical Society, the Pharmaceutical Council, and the Pharmaceutical Group of Manufacturers Association of Nigeria, whom we have met several times already, to bring in their ideas in this effort, which is a national effort, along the direction that the President wants us to proceed. On the financing side, to ensure that, in fact, there is type of capital that is necessary, debt and equity capital. And Afrexim Bank is one actor. And there are some, like the investor that I mentioned from Brazil, they bring in their resources, 240 million, to establish a manufacturing plant here in Nigeria to manufacture generic products that will serve Nigerian market but elsewhere. Or others that may be coming in to invest to manufacture diagnostic kits in our market to serve the Nigerian market, to create jobs for Nigerian youth, but also potentially to export to other places. There are also the regulatory constraints of the past, which we are addressing. So NAFDAC, as a health regulator, we've been pushing it to go from where it is now as maturity level 3, which is very good, by the way, one of the 3 in the continent, but to get to level 4. Because without a proper regulatory framework, it will be difficult for pharmaceutical industry and other industries to thrive. And the distribution of commodities, as you may have seen, recently we were in Kano, where there was a coordinated wholesale center that had been built, and there are a few others also in the country that we are trying to activate so that we close open drug markets and to streamline them to well-regulated wholesale centers where the quality of the products is ensured and counterfeit and substandard drugs are reduced. That will allow manufacturers to then be able to compete on the basis of quality, because in the absence of regulation, counterfeit and substandard products will undermine the viability of those who want to do right. So that is the regulatory side, and there are many facets of that as well. But the private sector itself has to organize itself because the hyper-fragmentation is not helpful, and their own capabilities, the knowledge transfer, the tech transfer, we've been trying to identify how those can be enabled in our current context so that technology transfer that is not in our country, it can be brought into our country. And we're looking at how that can be enabled. Research and development. Medical industrialization will only happen if it's based on good science. And again, very recently, Mr. President, thankfully, was appointed the Grand Patron by the National Academy of Science, which is a recognition for his interest, his focus, and his direction for all of us in his administration to ensure that we ground what we do around good science. Now, research and development is part of that. And he has assigned a group to look at how a research fund will be created to enable our academics. There are many researchers in Nigerian universities and institutions that are doing quality research, but the research just stops on the shelves or in the papers they publish. And the commercialization of those research, some of which is in health, some of which in the biopharmaceutical space, and some in many other fields of endeavor to unlock that. But at least for us in health, the research and development aspect is also core part of this, and through our agencies, NIPRID or NIMA, I think will foster that so that we can be able to do things like clinical trials that can demonstrate efficacy of products that are developed here as well. So those are the kinds of things that we are envisioning that over time, in the first 3-4 years of this administration, to be able to demonstrate movement, which is for the first time a different direction than where the sector had been, that had relied largely on imports from other countries that are just like us. And so it's a really key moment, and I really want to appreciate the President for this initiative to help unlock the value chain of the health sector as well. Yeah.
Fantastic. So, Prof, for the health sector renewal investment initiative, which will cover all the 774 LGAs in the country, where are we on implementing that program?
No, I've mentioned the Basic Healthcare Provision Fund, which will go from 8,800 primary healthcare centers to 17,000. But in addition, we are designing a social action fund. We had proposed it in 2024, and we are expecting a corrigendum from National Assembly to put it where it is, with the approval of the President already granted, for a social action fund. It's a different approach to community development. It's trying to put resources in the hands of communities so that they respond to their felt needs, not needs determined from Abuja or from state capital or from just some administrator who determines what a community's needs might be. In some communities, all they need is a functioning borehole to get clean water, or a facility that is lacking roof to be able to function, or a small house for health workers to stay, or to fix a gutter, or to clean up, or to have a home garden, and to put resources. It's an approach that has been tested elsewhere of community demand-driven interventions, not with big amounts of resources, but with very small amount of resources to communities to determine what they would like to solve. So empowering them, trusting in their judgments, and enabling them to do that with proper accountability measures so that we can show responsiveness to the needs of our citizens. That is the idea of the Social Action Fund, which in 2024 will roll out. We have not rolled it out. I think we are now in the early stages of the design. We've gotten the approval of His Excellency Mr. President because I think he really would like his administration to respond to the needs of Nigerians and to the felt needs of Nigerians, not only those of interlocutors who appropriate the knowledge of what communities need, because the needs of communities are very diverse. And so that's the idea of the Social Action Fund that we are designing at the moment. Yeah.
All right, so talking about the 2024 budget, gladly the budgetary allocation of the health sector has seen an increase. Speak to the vision of the president in this regard.
When the president said renewal, I think he meant it literally renewal, because in our 2024 federal government budget for health, there are massive investments in infrastructural upgrades, equipment upgrades, as well as training of clinical workers, whether they're nurses, doctors, physiotherapists, and other cadres, so that Nigerians begin to feel the effect of the investments of government in the services, the quality of services. So the 6 teaching hospitals in the 6 geopolitical regions of the country, Federal Teaching Hospital in Katsina, Lagos University Teaching Hospital, University of Benin, Jos University Teaching Hospital, Ahmadu Bello University Teaching Hospital, would have, and University of Nigeria Teaching Hospital, would have 6 world-class cancer treatment infrastructure and equipment, and to do that in collaboration with the Nigerian Sovereign Investment Authority, which has had a track record of similar oncology center at Luth, which is really performing excellently well. So the most efficient route is to go and get it done, and the President has approved it. I think the resources are in the budget. We're facing the challenge of some of the foreign exchange difficulties, but we'll find a way, at least to move in the direction of getting that infrastructure. There are several infrastructural upgrades in our teaching hospital, federal medical centers, and specialist hospitals that are going towards the front end, where Nigerians should experience at least an improvement. Despite the fiscal limitations of government, the prioritization of the President is manifesting itself in the additional budget devoted to the services that are going to touch Nigerians. And there are many other elements, such as the pooled procurement of pharmaceuticals, that will be targeted at the commodities that the poorest Nigerians and the most vulnerable need, so that in the face of rising cost of pharmaceuticals, there's some succor to the population by using pool procurement to get quality products at lower cost and to distribute them. That is included. Of course, the erosion of the value of the naira is challenging us in that regard. The training of health workers in specialized areas. Recent visit by Mr. President to Qatar. We're very fortunate that we were invited to visit the Hamad Medical Corporation in Doha, as well as the Sidra Medicine Quaternary Hospital, and to begin to forge partnerships whereby Nigerian health workers can be identified and sent to learn from from what Qatar is doing, as well as provide opportunities for collaborations with us here in Nigeria, not limited to Qatar, but several other countries as well, in addition to what we can also do here in Nigeria with the amazing teaching hospitals that we have, because we have really great hospitals that Nigerians have not yet fully discovered, but to ensure that they are put to use for the benefit of Nigerians. So essentially, if you look at our budget in 2024, it's really one of a giant leap towards renewal. We are being challenged, of course, by the situation of the value of the naira, but despite that, the health sector and the Federal Ministry of Health and Social Welfare in the last 10 years has not experienced the level of attention in terms of the resourcing that Mr. President has provided in his overall budget to support service delivery for Nigerians.
All right, I want us to talk about medical tourism, but before then, what should Nigerians expect from the Presidential Panel on Reform of Social Investment Programs, where you are a member.
Yes, the panel, I think in the President's wisdom, he constituted the panel and led by the coordinating Minister of the Economy, the Honourable Minister of Finance, who has led it excellently well, comprising several members of our team. And we have looked at the issue, not on the financial audit side, but the overall framework. What lessons have we learned over the last 8 years of intervening in social investments? And what can we do better going forward? On the targeting, on how to identify the individuals who need to get that assistance and to ensure that they have the identification and that identification is robust. And that has been tested, triangulated by the Ministry of Digital Economy and Communication to ensure the robustness of the register, not necessarily some other beneficiary register that is not the core register that has been validated, to ensure that those who are in that are indeed poor, they are identifiable, and the transfers will go to them, and that the transfers are electronic, so that there is no cash direct payments. And to test that, so as an interim report, and the leader of the panel has made that recommendation, and with all our support to Mr. President, to resume some of that social investment transfers, because of the circumstances that many of the poorest and vulnerable Nigerians are facing. Because at the end of the day, we also have to respond to those needs. And that is the direction that the Social Investment Panel, the Presidential Panel, has been going towards. So that there's some immediate relief, but that it's based on sound fiduciary mechanism that ensures the integrity of the transfers, who is receiving the resources, how they are able to receive the resources, the accountability and the governance around it, that it is enhanced. And that is out of the lessons that we have learned over the last few years. Yeah.
All right, then. All right. Let's now talk about medical tourism. You would agree with me that this is still a major issue in Nigeria, which in turn affects the economy. What are the efforts of the federal government to tame medical tourism in Nigeria?
Medical tourism, it's a phenomenon that is global. It's not just a Nigerian phenomenon. It's a global phenomenon. There are all kinds of tourism, whether it's religious tourism, educational tourism, or medical tourism. And you have medical tourism from folks in the United States leaving to go to Asia to get treated. People from the United Kingdom coming to Africa to get surgery. In the case of Nigeria, we for many years have had almost $2 billion outflow every year for people, from people going abroad for medical care. And that's a choice. If they can afford it, they go. The direction that we're taking is to say, how can we invest in our health infrastructure, enable the private sector, so that we retain those who go abroad, to retain the expenditure that they would have incurred abroad, and to add value here, keep our youth employed. And by building the health infrastructure on the public side, by encouraging the private sector to participate, over time we expect that folks will not have to travel to some other developing country to get medical care, that they can find those services here. And even before those investments fully mature, there are facilities in Nigeria. There are some of our teaching hospitals. You'll be surprised if you go to University of Maiduguri Teaching Hospital. Amazing facility. Or if you go to Ahmadu Bello University, or Lagos University Teaching Hospital, or University of Nigeria Teaching Hospital in Enugu, you will see amazing facilities, brilliant surgeons, highly qualified, and that Nigerians need to begin to patronize locally, because those services that they are receiving abroad can be often provided here as well. We're going to be groundbreaking of 10 health infrastructure. 8 of them are diagnostic centers very soon. 2 are oncology centers, which will give the high quality physical infrastructure, all parts of this country, that would be constructed, equipped, and delivered within 12 to 18 months. And that is through the NSIA and the health investment of the NSIA. Those are facilities that Nigerians can enjoy here. So in sum, there is a robust plan in the context of the health sector renewal to ensure that we have the infrastructure and the equipment. In terms of the manpower that is needed, Nigerians are very well trained in the health sector, whether they are nurses, doctors, pharmacists, laboratory scientists, all cadres. That's why they are attractive to other parts of the world. And I believe that with the infrastructural investments and with those that are abroad now trying to come back, you will begin to see more Nigerians remaining at home and some of that $2 billion being retained. And others in the sub-region come to Nigeria for medical care so that we're a hub for medical tourism.
So, Prof, I mean, earlier you talked about training and retraining of healthcare workers. But let's talk about welfare. I mean, according to medical practitioners, part of what is contributing to brain drain is low welfare package, hazard fee. What have you done to fix this?
Well, you sounded very skeptical when I said that Nigeria can deliver high-quality services. But I want to assure you that if we believe in ourselves, that we can be able to do that. Because you go to the UK, US, and many other places, you see Nigerians doing amazing things. Even last week in Doha, we saw amazing things being done by Nigerians. We believe in that spirit that Nigeria can do. And I think as part of Mr. President's agenda, we are confident that Nigeria will do over time. But it takes effort, it takes patience, and we're committed to doing that. Now, the welfare issue, before I address it head on, I'll have to say that we are very blessed by tens of thousands of health workers in Nigeria who have remained, despite all the difficulties, despite some of the challenges of insecurity, power, and the difficulties that we have faced over several years, have remained and are serving our population. They are intrinsically motivated. They are in health profession, not just because of what is in there for them, but because they want to serve others. And I want to call all of them out, that we appreciate the health workers, and Mr. President appreciates them. And in fact, he was appointed by the African Union as a champion for human resources for health in the African region by the Bureau of Heads of State of the African Union, because of this passion that he has around human resources overall. And for us in health, I believe that he also is very particularly interested in nurturing that. And we have to recognize that, respect that, and that it's not just about what people get in from that. It's about serving others and to tap into that. In terms of the welfare, I believe that there have been various interventions by successive administrations, including this one, to try to see within the limits of the fiscals that we have, we make it easier. There are certain things that we have already put in place to make it easier to recruit them, to retain them, to simplify, to train them, which are non-monetary incentives, but are valuable for many health workers.
Sadly, we're out of time. Thank you so much. I've been speaking with Professor Mohammed Ali Pate, the Coordinating Minister of Health and Social Welfare. Thank you so much for joining us tonight. And we wish you and your colleagues at the Ministry of Health the very best in actualizing the dream of the President for the nation. Thank you so much for joining us, sir.
Thank you. Thank you for having me.
And thank you very much for watching. That marks the end of today's episode of Politics Tonight. But the conversation continues from here. Get in touch with us on X at TVC News NG and at Olajumoke WO using the hashtag Politics Tonight. We're also on YouTube at youtube.com/TVC News Nigeria. I am Olajumoke Olatuji. Good night, everyone.